Hey, I'm going to show you a video today, just a really easy test that we can do for piriformis syndrome to see if it really is piriformis syndrome or not. Now the piriformis, really quickly, it attaches into this area of the hip, and a lot of people will feel pain right there, and they're like, oh, it's right there. I know it's the piriformis because I can touch it and it's tight. And no, okay? Here's an easy test. We can tell beyond reasonable doubt that it's not the actual piriformis, but it's something else, okay? Now, if you pan down a little bit, I'm gonna do this test, which is a round of the spine, number one, okay? And so I'm just gonna round the spine here, the low back, and just hang out here. Number one, if this creates low back, or it creates piriformis pain, my contact on the piriformis didn't change, but the round of my spine did. And so this is a differentiating test, and certainly if I bring my head down, it makes it worse. This also too is differentiating. It shows that actually I can change the pain in my piriformis by doing movement of something else. This would mean there's a probability of a lumbar spine disc driving the piriformis tension. It's protective. Another part of the test is I usually have people sit up a little bit but slouch a little bit and just toes up, and they just tend to creep the toes to the ceiling. They're like, ah, piriformis. I say, cool. Do that again real slow, and they're like, ah. And so I tell them to point the toes. They say, oh, it's better. And I say, go up again. They say, ah, piriformis. So there's nothing that attaches the piriformis to the toes except for things that are longer in that path, like let's just say skin, right? I'm not saying this is skin, but skin does. Lymphatic tissue does. Vasculature does. Nerve does. And so usually in this case, we're looking at nerve, especially if there's pins and needles in the foot. Now, I'll be honest with you. Over the course of my 10-year career, I've only seen 2 cases ever of real piriformis syndrome, but I've seen multiple people with piriformis pain. Most people will have a nerve root or a disc driving their piriformis tension. So this is one of the tests that we can use to figure out and see if you really are a piriformis case or not. So we're in Huntington Beach. If you're looking to solve this problem, you might just only be a couple weeks away from being over 50% improved. Just call us. We do insurance verifications for you, and let us help you out. Love to help you through this. You just need someone to guide you.